Hi, I'm Marie Ridgeway with Ridgeway and Associates, and we are recording for you a quick introduction to our wellness programming. If you're watching this, you work with one of our agencies, a first responder agency in Minnesota, and we are just wanting to help you become familiar with the work that we do and who we are, and also what to expect if you are going to reach out to us, either because maybe you have an annual check-in or might be wanting to do a therapy session. So we do, of course, therapy and check-ins. Check-ins are not therapy. They're just a quick informal conversation with us, and I'll tell you a little bit more about what to expect with those in a couple of slides here. We are often on site with different agencies. We might be attending a roll call or a ride-along, kind of getting to know your agency, your culture, the types of calls that you take. We do debriefs. We help with diffusing sometimes. And we also assist after critical incidents. We are partnered with Cortico, which is owned by Lexipol for app-based wellness. And then we also provide post-training and different types of mental health training. So peer support, CIT, officer wellness, we have all the different topics that we train on. And then also I train other therapists in how to work with law enforcement and first responders. One of our goals is to connect all first responders in Minnesota to somebody who knows how to help. And it, of course, takes kind of specialized care like we provide to do a good job to help our first responders. So I enjoy working with other therapists who want to further their practices. And then last but not least, we do clinical consultation for peer support teams and for CNT teams. We've got Charlie and Callie, who are both certified therapy dogs. They are half siblings. Charlie's been with us since he was 8 weeks old, and then Callie came to us more recently. She was a PTSD service dog for someone and was returned to our breeder, so we brought her on the team as well. We've got 6 total clinicians, and we work out of 2 different office locations. One is in Shoreview, and our other office is in Bloomington. We will be moving Shoreview offices pretty soon, and our website will have all of the updated information on that. And then we're also available for virtual appointments whenever that's necessary. And once in a while, we can meet up with you even more informally, and I call it a walk and talk. So when the weather permits, sometimes those are available in the spring, summer, or fall. So generally, we're interested in your quality of life. We're trying to help with that common stress response. We know that you all are very mentally strong, and it's really just stress that tends to start to take a toll since there is so much of that involved in the work that you do. We're really passionate about suicide prevention. We're fluent in suicidality. Sadly, it's a common topic that we help our first responders with. We know how to talk about it with you. We know how to not overreact and not underreact, and how to best assist. And then just big picture, we want to connect everybody to somebody who knows how to help, like I said. So you and any household member have a certain number of sessions available to you beyond your annual check-in that you may have. So it would depend on your agency to know how many therapy sessions you would have access to, but those would be employer paid. And we don't have to diagnose in those because we're not billing insurance, and those are completely confidential. So we bill with just a code to your employer, so they don't know who we're billing for. They just may see a code come through up to, whatever limit your employer has set. As far as confidentiality, we take it really seriously for both check-ins and therapy, of course, for both, but in check-ins, we don't even have to take notes. So not everything we ever do is therapy just because we're therapists. We are having, consultation or conversations with you. It can be an informal chat about how you're doing, or, whatever degree that you would like to get into details of, your wellness and your life, we're happy to do. And we don't report anything back to employers. So when your agency requires an annual check-in, we just put your last name on an invoice, and we keep track of who completed those check-ins, and then we let your employer know that it was completed, but absolutely no detail otherwise. And then as far as therapy, we don't have to diagnose, like I said. We take really brief progress notes, and then you have that privileged, protected relationship. It's doctor-patient privilege or an attorney client privilege. We have the same level of confidentiality and privilege as those other providers do. The only time we ever would have to break confidentiality is if somebody was an immediate harm to themselves or others, or there was abuse of a child or a vulnerable adult. And with that immediate harm to self or others, it would have to be a case where there's nothing else we can do to help you except break confidentiality. So those would be extremely rare circumstances. One of the things we'll talk about in check-ins, and that we're always interested and we focus on in our trainings and in our therapy sessions as well, is we really take an approach to your wellness that includes these 6 factors. So you'll hear much more about these as you continue working with us as your wellness provider. Our website, marieridgeway.com, has a program participant tab, and if you click on it and enter the password Charlie with a capital C, you'll see a lot more information on these factors in case you'd like to look into them yourself, but otherwise we'd love to chat with you about them. So ultimately what we're trying to do is really to offset and outweigh the kind of built-in withdrawals that your jobs have. So being a first responder includes, plenty of chronic work stress, potentially traumatic experiences you've been through, sleep depression because of your shift work, and then you have your personal life as well. You may have injuries that cause chronic pain. You may have major losses or stressors. And then there are these ripple effects of stress, like relationship strain, alcohol abuse. Any of these things are so common and need to be offset by things like the resilience factors. And the resilience factors include access to professional care. So if you've experienced something that's stressful to you to the point that you could use some help with it, we are available for that. So when you come in for a check-in, here's kind of a list of what a check-in is not and what it is. So on the left side, a therapy session, it's not that, it's not treatment, it's not an evaluation. In fact, nothing that we ever do is going to be a fitness for duty type of evaluation or assessment. And we don't have to document anything from those check-ins in any kind of medical record. So you don't become our client by coming to a check-in. It's really just like I said, a casual conversation. And then a check-in is, though, education. It can be, we can speak with you about different pieces related to the resilience factors or to trauma that could be helpful for you to know, and problem solving things with you. Ultimately, we want to make sure you have a positive experience, and we want you to get to know one of us so that if at any point you need to reach out, you can feel more comfortable doing so, just because you've built a little bit of familiarity. And then last but not least, therapy. So all we do is work with first responders. We're trauma therapists. All of us are trained in trauma therapy. And then we specialize even more than that by working exclusively with first responders. So within therapy sessions, you may want to talk about personal or professional topics, and any of that is just fine. And some of what you may want assistance with is relationship strain, and we're able to help you with that as well. We have a specific type of trauma therapy that we do called ART, or accelerated resolution therapy. Many of our first responders use this and notice a really positive benefit. And you can learn more about that on our website, or we're happy to talk to you about that more if you are curious. So we know you're all really mentally strong, and we really don't deal with mental illness at our practice. 99% of the time, we're just helping folks with stress symptoms. And like I said, kind of those ripple effects that can come from those. So I wanted to give you all a chance today to just hear really briefly from each of our clinicians. You've probably met me already in person potentially, but I've spoken to you a little bit here about what to expect with our programming. But for me personally, outside of work, I have 2 kids, teenagers, 13 and 15. I like to stay really active, and I like to travel. It's certainly the way that I kind of keep a balanced life, and make sure that I get to have new adventures and fun. And I really look forward to trips that I plan. So that's usually what I'm doing if I'm not with my kids or working, or I bring my kids with me on the trips. So we have a lot of fun doing those things. And then my dogs, of course, are a huge part of fun in my life. So I will let Jerry do a quick introduction, and then we'll kind of go from there.
Hello, everybody. Thank you, Marie. I'm Jerry Diefenbach, and I absolutely, when I meet with you, will ask you how your jar of unprocessed stress is going and how we're going to deal with that and take care of that. So I, very much like Marie, I am an active mountain biker. I just mountain bike today. I also am a cross-country skier in the wintertime, and is one of my passions of talking to clients with this, how to get physically active, how to unpack stress and deal with the stress that you all deal with on a daily basis. So I look forward to meeting some of you, and I hope you're taking care. Thank you.
Hi, I'm Katie Strub, and it's nice to meet you all. I look forward to seeing you. Like Marie and Jerry said, I am an avid outdoors person. I just took my 12-year-old daughter on her first backpacking trip, which was quite the experience. I'm also into mountain biking and just being outdoors. Professionally, I've been working with Marie for a couple of years, actually 3 years now, and I've been in private practice for a lot longer, and I absolutely enjoy working with, anxiety, trauma, stress, and so I am just really enjoying doing this work and helping you all be proactive about staying really healthy.
Hi, my name is Nicole. Following everybody else, I have 3 small children, twin boys age 3.5. I have an 8-month-old. So they keep me quite busy. I enjoy lifting weights. That's what I like to do when I do have free time. I was in the Marine Corps, did 5 years active duty with 2 deployments. During the Iraq War, I was in Kuwait during the first initial push in 2003. And then was in Fallujah in 2008 to 2009. That's what made me want to get my degree in the first place, was to be able to help first responders, veterans, because I saw kind of what happened when people didn't take care of themselves. And so that's why I want to help people like you, like myself, like, the first responders in the community. So I know that, there is help for all of us. So that's why I like trauma work. Sleep is very important too. So yes, take care of yourself and enjoy life, and I will meet you all very soon.
Hi, my name is Carly. I have been working for Marie and with Marie for about 2 years now. Outside of work, I really like to relax by traveling, being with my family, including my dog, trying new foods and new restaurants around the Twin Cities, and then being active outside in the summer and not outside in the winter. I can't wait to meet some of you, and I hope you are all taking care of yourself.
Hi, I'm Natalie Sinclair. I have experience working with police and first responders as a social worker in different capacities, and that led me into this field working therapeutically. In my free time, I love to hike with my dog, travel, do home improvement projects, and spend time with my family. Look forward to meeting you.
All right, awesome. Thanks, everybody. I just wanted to echo what everyone said. We hope you're all taking good care of yourself, and it's hard to do though. So if you're struggling in any way, we would love to be able to help. That's what we're here for. Ultimately, we'd love to work ourselves out of a job, then we'd be doing a great job. I hope that you take care and stay safe.